You're watching ABC4 News.
Welcome back. The recent death of actor Chadwick Boseman is putting a spotlight on colon cancer. Intermountain Healthcare reminds us about the importance of getting regular screenings. ABC4's medical correspondent Saray Chen reports.
And so I was literally at home on Friday night when my friends called me, knowing I'm an oncologist, and said, "Did you hear that Chadwick Boseman died of colon cancer?" And I was stunned. I was literally watching one of his movies with my 9-year-old son when that happened, and he looked so healthy and vibrant. So the message is, this is not a disease exclusively of older people.
In fact, Dr. Mark A. Lewis, a medical oncologist and director of gastrointestinal oncology at Intermountain Healthcare, says the tragic death of actor Chadwick Boseman to colon cancer at age 43 is a startling trend he's seeing of young patients under the age of 50 diagnosed with colon cancer.
Someone born in 1990 has double the risk of colon cancer at the same age as someone who was born in 1950. And quadruple the risk of rectal cancer.
Colon cancer has actually been declining in people over age 65, but increasing every year by 2% in people younger than 50. Melissa Inouye from Draper, with no family history, was diagnosed with the disease 3 years ago at age 38.
I eat healthy, I cook from scratch, I run marathons. What's up with this?
Health experts want to know, too. Dr. Lewis says one theory is
antibiotic use in childhood might change our gut for the rest of our life. And if you think about it, what really I think distinguishes this generation as opposed to prior ones is there probably has been more ready access to antibiotics when we're younger. We still don't understand it, but it's possible antibiotics raise the presence of sort of bad or cancer-causing bacteria and lower the presence of protective or good bacteria.
Intermountain Healthcare says more than 150,000 Americans develop colorectal cancer each year, making it the second most common cancer-related cause of death in the country. Recommendations for regular colon cancer screenings should begin at age 50 for most people unless there's a family history. The rise in the number of colon cancer cases among young people is troubling. That's why Dr. Lewis and many health experts say to be your own advocate and see your doctor if you have any symptoms.
Young people, as embarrassed or unusual as they might think it is, should definitely tell their doctors if they're having abdominal pain, unintentional weight loss, or if they're seeing blood in their stool. And again, I know this is not pleasant to talk about, but I cannot tell you how many times I've seen either the patient assume they have hemorrhoids, or, and this is more of a problem, I think, the doctor assumes they have hemorrhoids and sometimes gives that diagnosis without even doing an exam or a colonoscopy.
I think I feel the way that a lot of cancer patients feel, which is there's a lot that we can't control, and it's the fact that we can't control it that is often the most painful. But at the same time, if you can kind of get into the spaces where you don't try to control what you can't control and focus on what you can control, that part of life is pretty good.
And she says when it comes to helping friends who are cancer patients,
there's actually not that much you can do about the cancer in a friend's body. But what you can do is you can kind of you can understand that cancer patients are people who don't feel entitled to a lot of time. So if you give them power and amplify their voices and help them achieve their missions that they're working on, that makes a huge difference to us.
Saray Chen, ABC4 News.